With our next guest when she joined us a couple of weeks ago, and our summer skincare series is going to continue this morning with new treatments for pesky acne scars.
Dermatologist Dr. Truitt is joining us now live on Zoom. Good morning, Dr. Truitt.
Good morning. Thank you for having me.
Thank you. So acne is so common for many people, but scarring can be really distressing for a lot of people. How many people are affected by this?
Yes, so 80% of the population are going to have acne at some point. That's 60 million patients alone in the US. Of those patients, 40% will have acne scars. And yes, it can be very psychologically distressing to a patient, really lead to a lower quality of life. And in fact, studies have shown that the perception of patients who have acne scars is that they are less confident, less successful, less attractive. And so it's really no wonder that we have tried so hard to give these patients a better treatment.
We're seeing some of the treatments that you're doing on your patients right now. Tell us about microneedling and some of the surgical techniques that are used.
Yes, so in my clinic, the go-to is to do a combination of subcision and then also with one of the newer devices on the market, it's radio frequency with microneedling. I happen to use the Cynosure version called Potenza, but what subcision does is go in and treat the base of the scar, but then the radio frequency and microneedling will then go in with, it has a small array of tiny needles that inject into the skin and then will deliver radio frequency at multiple levels. And what this does is it will cause tissue injury, but it is uniform. So you will have a uniform remodeling of the skin and will then improve the texture and the tone.
I've actually done microneedling before, and it's great. How many treatments do you think someone would need to see improvements?
It really kind of depends on the patient, on the type of scarring that they have. There's traditionally three types of scarring. There's ice pick, boxcar, and rolling. The ice pick and the boxcar tend to be a little bit deeper within to the dermis, and so they're a little bit more difficult to treat. And so it may actually also require a few more treatments. So really the number of treatments will vary, but it can be anywhere from between 3 to 6 treatments. But what I really like about the microneedling with the radio frequency is that you have minimal downtime. Really, it's redness for a few hours, minimal side effects. But the best part about what I really love is that it is colorblind. I can treat any patient of any skin color.
It's really interesting and a good way to treat acne scarring that maybe lasts years for some people that have to deal with it. So Dr. Truitt, thanks so much for joining us this morning.
You're very welcome. Thank you for having me.
Take care.